Hello, my name is Kanisha Williams, and I'm a nurse practitioner student at Herzing University, and I will be conducting my comprehensive health exam. This right here is my patient, Miss Filmer Williams. How you doing?
Good, and you?
I'm good. Thank you for asking. First, what we are going to be doing is asking you a series of questions, and then we're going to be doing a physical examination. But I will let you know in between everything that I will be doing prior to doing it. All right? Can you do me a favor and state your last name and date of birth?
Williams, June 12th, 1993,
All right, and can you tell me the month that we're in?
December.
All right, and then can you tell me where we're currently at?
Doctor's office.
All right, and first I would like to ask you if you are all caught up on your vaccinations this year?
Yes, I am.
And what about your influenza? Because it is flu season.
Yes.
Okay. What's bringing you in today?
Just a physical exam.
Physical? Any complaints today that you would like to discuss?
No.
All right. Any health history for you?
I have anxiety,
Okay.
high blood pressure, MDD, and PTSD.
All right. And what does MBD stand for?
Major depressive disorder.
All right. Okay. So do you currently take any medications at home, especially for these?
Yes.
All right. And what do you take?
I take Zoloft, 100 milligrams,
Okay.
and nifedipine. I don't know the dosage. I take both of them once a day,
Okay.
every day. So
And have you been taking those? Okay.
yes.
All right. And any allergies currently to any medication?
Not that I know of.
And do you check your blood pressure at home?
Yes.
All right. And has it been going good so far?
It's been up and down, but
Well
more on the
controlled?
good side.
On the good side? Okay. Any headaches, dizziness, numbness or tingling anywhere? Any weakness on one
No.
side?
No.
Have you, for your blood pressure, you haven't noticed any headaches or weakness?
No.
All right, that's good. Those are the things that we want to watch out for, especially with high blood pressure. We want to definitely, I like the fact that you're checking your blood pressure daily, because what we want to make sure is that it doesn't get too high because that puts you in territory of stroke. Signs that you may want to watch out for is drooping on one side of the face, or if you have any weakness on one side. And if you're unable to communicate, then that's a neurological emergency. All those signs point to a possible stroke. And with your health history, you want to get that checked out. All right. And when was your last pap smear?
Earlier this year, around late July.
Was it normal?
Yes.
All right. So women, if we have a normal pap smear, especially around your age, we don't have to get another one for 3 years. So that's when it's normal. If it's a reason that calls for us to get another one, then they would come and do that earlier. All right. Let's talk about your family history. So starting with your father's side, does your father have any medical complaints?
He has high blood pressure.
High blood pressure? And how old is he?
58.
Is he still alive?
Yes.
And then let's talk about your father's parents. So let's start with your grandmother first.
I actually don't know her medical history.
Oh, that's okay. But is she still alive?
No.
Do you know how old she was when she passed?
75.
Do you know what caused her to pass?
They say natural causes.
Oh, okay. And then let's talk about your grandfather earlier.
I've never met him actually.
All right. And then now let's move to your mom's side. Does your mom have any medical conditions?
As far as I know, she only has lupus.
Is she still alive?
Yes.
And how old is she?
48.
All right. And then as far as like her parents, start with her mom. Any medical problems?
She was diagnosed with breast cancer. I don't actually remember when, but she was diagnosed with it.
And is she still alive?
Yes.
Do you know how old she is?
No.
And then what about your grandfather?
I actually don't know. I've never met him.
Okay. No, that's totally okay. With the history of breast cancer, does she currently still have breast cancer?
Um, last time I checked, she did,
She did.
but I haven't checked in a while or asked about it in a while.
All right. So do you do self breast exams at home?
No,
All right. Do you know how to do a self breast exam?
yeah,
All right. And signs that you want to watch out for, especially with like possible like tumors in the breast, is if there's any dimpling in the breast. If you notice like there's a rock hard like lump that's not movable in the breast. If you notice any drainage from the nipple, like bleeding or like any abnormal drainage that doesn't belong there, you want to definitely get that checked out right away. Another thing is that under the armpit, we have lymph nodes. Do you check those?
yes,
All right, so great. Check those, because you definitely want to check those to make sure that there's no swelling or abnormal growth, because with breast cancer, there can be lymph node problems with the lymph nodes as well, and that corresponding breast. All right. Let's talk about your social history. Do you smoke cigarettes?
no,
Drink alcohol?
No.
Using recreational drugs?
no,
Any thoughts of hurting yourself or anyone else?
not anymore.
All right. And you feel safe at home?
Yes,
Who do you live with?
my big sister, her kid, and my dog.
All right. And are you in school?
Yes,
A full-time student, or do you work part-time?
full-time student.
Do you work at all?
No.
All right. And then as far as like health insurance, you're able to have health insurance and
Yeah.
stuff and get to the like doctor's office regularly to follow
Yeah.
up with your checkups? Beautiful. Love it. And you said no allergies to medications,
No.
correct? All right, so we are going to get ready to go into our physical assessment. First, what we're going to do is we're going to start off with the face. So we're just going to stand here. We're going to check for symmetry. Eyes are symmetrical, eyebrows are symmetrical. We're going to check the skin. There is some scarring around the skin. We are also going to check to see if there's any drainage, no nasal drainage noted. And then we're going to get ready to palpate the skull. I would like to cover that prior to this exam, we did check her visual acuity, which was 20/20 with her glasses on the scaling chart. And then we also did get a set of vital signs. Her blood pressure was 148/63. Pulse was 90, respirations was 16. And can you do me a favor and state your height and weight?
I am 5'4" and I weigh 197.
Beautiful. All right. So we're going I'm going to take my hands. I am going to palpate against your skull. And I'm going to check for any flaking in the scalp. I'm also going to check for any lumps, any tenderness. You just let me know if you have any tenderness, and we'll go from there. All right. So I'll have you pull your hairband out. Your glasses can stay on for now. I'm going to have you bend towards me. All right. Any tenderness? No. All right. So hair is dry. It's thick. No lumps noted. Any tenderness back here?
No.
All right. I have noticed that there is some flaking. I'm going to just turn your head towards the side real quick. I have noticed that there is some flaking on the scalp and some dandruff areas here. Let's check here. Oh, dandruff there. And let's check here. So it's more towards the center of the scalp. Any pain up there?
No.
All right. So we can put your headband back on here. Beautiful. So while we're doing that, I am actually just going to palpate your sinuses, your facial and your maxillary sinuses. And I'm also going to palpate your temporal artery, okay? So we'll start with the temporal artery. both temporal arteries on both sides are both strong and bounding. Does this hurt at all?
No.
So this is just your frontal sinuses. We're just gonna check for any tenderness here, anything here. So no tenderness on the sinuses. All right, and then we're gonna just quickly check your facial nerve. So I'm gonna have, facial nerve is 3. I'm gonna have you raise your eyebrows. Beautiful. Close your eyes. Give me a big smile. Give me a big frown. Oh, it's okay. All right. So, cranial nerve 3 is intact. Next, what we are going to do is check your ears. We're going to check to make sure that they're symmetrical. We're going to check both for any abnormal drainage, which none is noted. We're going to check this outside skin. No tenderness. All right. No tenderness over here. All right. So no tenderness noted to bilateral ears. Now we're going to check the inside of her ears, and at the same time, after we check each ear, we're going to also check the whisper test. So first I'm going to just check this one. All right. So in this ear, the tympanic membrane is visible, no redness noted, no drainage noted, no bulging of the membrane. All right, and while we're back here, we are going to just quickly check cranial, check the whisper test, okay? So I'm gonna have you repeat what I say to you.
99.
Beautiful. Okay, so just like the other ear, we are gonna take a look inside this ear here. All right, so this ear, I'm actually unable to visualize the tympanic membrane because of being obstructed by this rumen. No redness though noted to the sides. No abnormal drainage noted. Are you having any problems with hearing in this ear? No. All right, so we're gonna also do the whisper test on this side as well. This is checking cranial nerve 8. All right.
Apple.
Perfect. Okay, so I do not have a tuning fork present, but when we are assessing the Weber test, we are going to tap the tuning fork to get some vibration, and we are going to set it in the center of the head. We're going to ask the patient what side can they hear from, and normally the patient can hear from both sides. If they only hear from one side, that's abnormal. Then we will also assess the Ryan test, which we will also, again, create a little vibration. We're going to check bone conduction first by placing it on the mastoid bone behind the ear with a tuning fork forward. And then I'm going to ask the patient when can they hear it. And once they say that they can hear it, you remove the tuning fork and you place it right in front of the ear, and you ask the patient when can they hear it. And it's normal for air conduction to be greater than bone conduction. All right. So we're going to just set this down. Well, while we have this, actually, I'll check this off. Sorry. We are going to just quickly assess your nose. So we're going to assess the patency of your nostril. We're going to feel and touch. We're going to feel and touch. I'm going to just take a little peeky peek. Okay. No nasal drainage? No. All right, no swelling noted, no nasal drainage noted. Nose is like pink on the inside, not reddening, and it doesn't appear to be irritated. Quickly, we are also going to just assess our cranial nerve 9 and 10, and then we're also going to assess cranial nerve 11 as well. All right, so I'm going to have you open up your mouth. and look forward and just hold your head back just a little bit so I can take a look. Okay, I'm gonna pull you just a little forward. Just come down just a little bit and go ah. Oh, beautiful. So mucous membranes are nice, pink, and moist. No lacerations, abscesses noted anywhere in the mouth. As far as gums, I'm gonna just pull your. Okay. Just come up just a little bit. Sorry. Yeah, let me see it. Beautiful. We do have a cracked tooth over here on our right side. 2 cavities in the back on the right as well. And cranial nerves 9 and 10 are intact. I'm gonna have you stick out your tongue and move your tongue to the side. Tongue is symmetrical. Yep. Beautiful. Cranial nerve 11 is also intact. We will not be assessing cranial nerve 1 at this time, but cranial nerve 1 we will assess for smell. All right. Next, what we're going to do is assess your eyes. So I'm going to have you take the glasses off. And as stated before, vision is 20/20 with glasses on using the scaling chart. All right, so I'm going to have you look forward at me. Beautiful. And we're going to assess your cranial nerves 3, 4, and 6. I'm going to have you follow my finger. Beautiful. Great. All right, so I'm going to have you watch my finger. This is going to be the fun part. How did that feel? Okay. Right. Go ahead, put your glasses back on. Next, we are going to assess cranial nerve 2. I'll have you take your hand. You're going to cover up your eye. I'm going to have you tell
2.
me. All right.
4.
Okay.
3.
Beautiful. Cover up the other eye.
1, 2, 3, 4. 4.
All right. So cranial nerve 2 is intact as well. I'm going to have you bring your hand down. You're going to dislike me. Just take this off for a second. And now what we are going to do is we're going to assess your pupils, and we're also going to take a look at your sclera and your conjunctiva. Where's my pin light? All right, so first what we're going to do is assess your pupil response. All right, keep looking forward. Beautiful. Beautiful. All right, so pupils are forereactive and brisk. And I'm going to just take a look at your sclera. So I'm going to actually have you look up towards the ceiling. Sclera is nice and white. A conjunctiva is pink and moist. No escaldate or swelling noted. And no drainage noted. All right. And I currently do not have an ophthalmoscope. And when we assess for the fundus of the eye, we are looking for the red reflex with the light. We'll dim the room for the red reflex, and we'll shine the light in and take a look towards the back of the eye. When we find an optic disc, we'll assess the color, and we'll also assess the arteries as well. All right. Still doing okay?
Yep.
Okay, so next what we are going to assess is we're going to palpate the lymph nodes. All right, so we're going to start from the front. You let me know if there's any tenderness. All right, so any pain or tenderness?
No.
Now let's go behind the ear. Any pain or tenderness?
Mm-mm.
Any pain or tenderness?
Nope.
No problems with swallowing. Okay. And we're going to come down. Any pain or tenderness?
Mm-mm.
What about here?
Mm-mm.
Supraclavicular lymph nodes. Any pain or tenderness?
Mm-mm.
All right, that's good. Now I am actually just going to assess your neck, so I'm going to have you sit forward, and we're gonna assess for like symmetry, which is symmetrical. I'm gonna have you just hold your head up just a little bit, and I'm gonna just take my finger and just try to find my landmark, and we're gonna assess your thyroid gland, okay? So, all right, now have you swallow? All right, so thyroid gland is not swollen. Was there any pain with that?
Nope.
No pain noted. No abnormal swelling noted. Trachea is midline. All right. So next, what we're going to do is we are going to, while you're still in a sitting position, we're going to assess your your posterior thoracic and your anterior thoracic. Okay. All right. So first, what I'm going to do. Okay, so yep, have you lift your body. Okay, cool. Okay, so we're gonna assess the posterior thoracic. We're gonna check for any open cuts, sores, bruises, any lumps anywhere. We're also gonna assess for any tenderness. Any tenderness? No. No crepitus? And I'm actually just gonna assess the entire back since we have the back exposed. All right, now we're gonna assess for tactile orphanitis. So what I'm gonna have you do is say 99. While I hold onto your back, we're gonna check for vibrations, okay? So
99,
beautiful, right?
99,
Uh-huh,
99,
okay, we'll just,
99.
all right. And while we're back here, I'm gonna quickly just check for expansion of the chest wall. Go ahead, one more time. Beautiful. So expansion is symmetrical, no barrel chest, no labored breathing, no respiratory distress noted. All right. And next, right before we auscultate, I am going to percuss the back, and then I am also going to percuss the kidneys as well. Check for any pain. So, you tell me if you're having any pain with this. I'm just going to listen. Sorry, pick that up so we can see. Okay, so during percussing, lungs were resonant. We're also going to check for the kidneys and check and see if there's any pain. So, any pain? All right. And right before we auscultate the lungs posteriorly, have you bend forward just a little bit? I'm going to just quickly check your spine. And run my finger down your back just to check. So far, no abnormal curvature, no pain across the spine. Okay, all right, so next what we're gonna do is auscultate the lungs. So I'm gonna have you do me a favor, take a few deep breaths for me when I instruct you to, okay? Deep breath. One more. Another deep breath. Deep breath. All right. All right, so lung sounds are clear bilaterally, posteriorly. No advantageous breath sounds noted from the posterior. Okay, so next what we're going to do is we're going to assess your anterior chest wall. I'm gonna raise the head of the chair so you can actually sit back for a little bit. All right, so in doing so, I am gonna do what we did before, where we're gonna place my palms of my hands on your chest. I'm gonna have you say 99 and we're gonna assess, okay?
99,
Yep,
99,
beautiful. And I'm gonna come down just, I'm gonna actually have you just lift you.
99,
Perfect. All right. I am going to just percuss the anterior lungs as well, okay? All right. And then next, what we're going to do is we're going to take a listen to your lung sounds. We're also going to listen to your heart as well and kind of kill two birds with one stone. Okay, all right? Take a deep breath. Just gonna go under your breath. And over here. Sorry. All right, and I'm just gonna take a listen to your heart. You can breathe normally. I'm gonna have you lift up your breaths. Yep, just this side, sorry. All right. So lungs are clear anteriorly, bilaterally, and heart sounds are strong and mounting. All right. So since we are inside the sitting position, we are also going to assess your reflexes as well. Okay? Okay, so I'm going to have you just relax that arm. I'm going to have you just relax. Just relax. Sorry, get out of the way. Beautiful. And while we're over here, sorry. All right. And then what I'm going to do is have you take your hands, hold them together really tight, and we're going to check your reflexes. All right. Reflexes are intact, +2. You can relax your arms. Reflexes are intact. While we're doing my physical assessment, I am also assessing skin. When I assessed the back, there was no open areas. As far as arms, there are a few sores, scars located on bilateral arms. Where did these scars come from?
trying to learn how to skateboard and ride my bike.
All right, so there are sores located on both. We are going to check quickly for the brachial pulse. Sorry, I'm just going to open up your arm a little bit. Great. And we are going to, I'm just going to reach over and we're going to check for the, relax this arm. Beautiful. And then we are going to check for both radial pulses. All right, pulses are all strong bilaterally, +2. We are now going to check for muscle strength. No weakness on one side at all? No problems with numbness or tingling on any arms? Okay, so let's have you squeeze my fingers as tight as you can. Beautiful. I am going to pull. You pull towards you. Great. Now push me away, push me away. Beautiful. Muscle strength is strong bilaterally. Let's take your arm. We are going to do some quick range of motion exercises. I just want to make sure that that's intact. So we're going to have you raise your arm out towards me. Any pain?
No.
This bend at the elbow. Great. Wrist. No pain?
No.
All right, and we're gonna do the same with this arm. So I'm gonna have you hold my hand up towards the ceiling, bending, any pain, wrist, nope, beautiful. Go ahead, relax that. Let's take a look at your hands. I'm gonna take a look at the skin on your hands. Nails are nice, long, and thick. CMS is intact, which is good. Okay, so I'm gonna have you close your eyes. We're gonna take nights, yeah. Oh, let me explain first. We're gonna just assess for like sensation. So I'm gonna take an object and we're gonna rub it across both your face, arms, and legs. And I want you to tell me if it's sharp or if it's soft.
Okay.
All right? Give me like 1 second. Where's my sharp object? Okay. Okay, so have you close your eyes. And you're gonna feel me touch. Sharp. Soft. 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 Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft. Okay, so you're gonna feel me touch at the bottom of your legs. I'm actually just gonna leave your pants legs up as well. Sharp. Sharp. Soft. Soft. All right, sensation is intact. Okay, so next what we're gonna do, we can actually lay back now and we're going to take a look at your belly and then we will listen to your belly. All right? No abdominal pain, no constipation, diarrhea, no. No problems with urination, blood, or burning, no. No blood in your stool, no. Is this okay? Yeah. Let me get your feet up. I'm going to actually have you put both up there. All right, so I'm actually just going to grab a pair of gloves because we're also going to palpate the temporal artery. The femoral artery as well. Okay. All right, so what we're going to do is just take a look at your belly. We're going to keep your chest covered. We're going to check for symmetry, which your belly is symmetrical. There's no herniations noted, no abnormalities around the umbilicus. We're going to just take a quick listen first. Vowel sounds are active. Okay, so you are going to feel me touch and we're going to just percuss on your belly, okay? Good. No pain?
Nope.
All right, so next what we're gonna do is I'm gonna palpate your belly. We're gonna start off light and then we're gonna go hard. All right? No pain?
Nope.
Okay. All right, I'm gonna just go deeper. No pain? Beautiful. Okay, so abdomen is soft, no pain with palpation. Now what we're gonna do is just take a feel for your liver, okay? So I'm gonna instruct you to first, I'm gonna just try to, okay, so that's what we're gonna have you do. To have you take a deep breath in and then let out. Okay. So the liver, the outline of the liver is nice and soft. We're next going to try to feel for the spleen. Any pain while I'm pressing? All right, so we are unable to palpate the spleen, which is normal. And then while we're down here, we are going to palpate, see if we can find the kidney. Touch. No pain? Sorry. Any pain? All right, so we are unable to palpate the kidney, which is also normal. Next, we're gonna feel for the temporal artery. So I'm gonna just take my finger and put my finger here. And I'm gonna feel over here. All right, so artery is intact, it is strong and bounding. Okay. All right, so while we're in this position, we can cover you back up. Okay. Okay, so next what we're going to do is we're going to palpate for the popliteal artery. We're also going to just take your shoes off and we're going to palpate for the pedal artery as well. There we go. Okay, and then we're also going to check range of motion as well. Okay, so I'm going to have you just bend at the knee ever so slightly. Popliteal artery is strong and bounding. You're gonna feel me, yep, bend at the knee. Any pain? No. I want you to relax your leg a little bit. Just relax it a little bit. Any pain? No. All right, let it down. No pain here? No. Okay, and then we're just gonna feel for your pedal pulse. All right, pedal pulse is true and bound, strong and bounding. We're gonna just now assess your left leg. All right, pedal pulse is strong. Popliteal pulse is strong. I'm gonna bend at the leg. Any pain? All right. Any pain here? Oh, just relax your leg. Yep, let me move it. Go ahead and relax that. So let's check your pedal pulse on that side. Beautiful, and then we're gonna quickly just check strength. So I'm gonna have you press up against my hand like a gas pedal. Beautiful. Any pain with that? No. All right, so I'm gonna do quite a few things. We're gonna set you up now. All right? Yeah, so give me 1 second. Let me just, do you feel okay sitting up? Yep. All right, put this in here. Beautiful. And then I did forget to check for your temporomandibular joint. So all right, just quickly just check that over, and then we are going to do our assessment. I think continue on with our assessment. Okay, so feel me touch. All right, so bite down with the teeth really hard. Yep, love it. Now open it up. Any pain?
Mm-mm.
Open it up again. All right, no clicking, no pain noted. All right, okay, so do you do me a favor? While you're sitting up like this, take this leg. Let me just straighten this out for you. And we're gonna do heel to toe, okay?
Mhm.
So rub your, so take this one, yep. Yep, up. All the way down, keep going. All right. Next leg. All right, beautiful. And I'm just gonna quickly check your foot. Do the Babinski reflex. It tickles, I know, I'm sorry. All right.
Also, the name is funny.
Oh. All right. So we are going to stand up on the floor. Well, let's do this first.
Okay.
Finger to nose and do it fast. Yep. Beautiful. Let's do that next hand as well. Okay. Beautiful. Good. So heel to shin and a finger to nose test, rapid, both intact. All right, so that's right. We're gonna stand. All right, so first what we're gonna do is just check range of motion of the spine. I'm gonna have you stand and move side to side. Any pain with that?
Nope.
All right, bend backwards. Any pain with that?
Nope.
Okay, bend forward, touch it. Well, attempt to touch your toes. Any pain with that?
Nope.
All right. Okay, so next what we're gonna have you do, is I'm gonna actually have you walk right here towards this wall, and we're gonna walk on our tippy toes. Beautiful, and turn around. Walk on your heels. Beautiful, stand straight. Any problems with that?
No.
All right, that's good. Okay, so, the next one I want you to do, it looks like you're doing a whole lot of walking. I'm gonna have you turn back towards that wall, and I'm gonna have you walk heel to toe, okay? So, heel, yep. All right. I'm gonna have you come back towards me. Do you feel okay?
Yep.
All right, come back, stand, right here. Beautiful, stand straight. And then I'm gonna have you close your eyes and stand still. Good, 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 good. Looks great. I have you close your eyes. We're gonna try to identify some objects in your hand. All right, so, point of this test is to see if you're able to identify objects when they're placed in your hand, okay?
Key.
All right.
Pen.
Okay. All right, how you doing?
Good.
You can open your eyes. Okay, so, go ahead and have a seat. And quickly, I'm just gonna quickly just check your, lower legs again. All right, so I'm just assessing for even distribution of hair on your lower extremities. I'm also gonna assess for any, swelling, or any redness or edema. All right, so. No temperature is nice and cool, no, warmth noted, no redness noted, hair is evenly distributed, ankles are not swollen. All right. Okay, so that will conduct our physical examination, our comprehensive physical examination. First, do you have any questions for me?
No.
All right, so again, with your blood pressure, you want to make sure that you check your blood pressure daily like you've been doing, which is great. If anything changes with that blood pressure, you want to go and get that blood pressure checked out. If you start to notice any like increased head pain unrelieved by like Tylenol or ibuprofen, you want to get that checked out as well. Any weakness on one side, problems with vision, double vision, blurry vision, even with your glasses, you also want to get that checked out. But you want to watch out for stroke signs because you're at higher risk of developing a stroke with a history of high blood pressure. So if you have weakness on one side, or if you're unable to like talk or gather your sentences, you want to get to the emergency department. Any drooping of the face, you want to get that to the emergency department as soon as possible. Okay?
Okay.
No problems with making it to your appointments, like you're able to make it to your appointments, there's someone
Yeah.
that will be able to take you, okay. And as far as like insurance, like you don't need any resources for insurance or anything? Okay, great, so it was nice meeting with you. Thank you for completing this comprehensive health exam with me. You have a good rest of your day.
You too.
All right,